Pneumonia is a bacterial infection. It is not, of course, you can get viral pneumonias, but more common is streptococcal pneumonia or what you call as community-acquired pneumonia. These are secondary bacterial infection. But remember that, and these are amenable to treatment and they're amenable to prevention also. So there are separate vaccinations called as pneumococcal vaccination. And the beauty about the pneumococcal vaccination, unlike COVID or unlike influenza or any other thing, it's normally once in a lifetime. It's a simple jab. And unlike the COVID vaccination, which at least they're talking about some side effect, till today, I have not touched wood, I have not seen a single side effect after pneumococcal vaccination. So last year itself, we started. Of course, the guidelines were there even before that. But last year, when COVID started, when we had no COVID vaccination, what we started was we started a movement saying that let's do two other vaccinations. One is influenza vaccination, because influenza is also a coronavirus. Remember that. It's very closely related to COVID. In fact, the symptoms are very similar also. The virus is also very, that's why this is called as a novel coronavirus, the COVID-19 one. Okay, SARS-CoV-2 we call it. So we said, let's do the influenza vaccination, which is of course once a year. And let us do the pneumococcal vaccination also, because influenza also can get a secondary pneumonia. Okay. And especially in older people, one of the commonest cause of death is pneumonia. And once you take this pneumococcal vaccination, you're almost definite for life, you're protected from a pneumococcal pneumonia death. Even if you get the pneumonia, you will not, die from it, or it won't become severe. So that is one campaign that we started last year. Thousands of people took it. Surprisingly, those who took the influenza vaccine, I didn't guarantee them saying it will have anything to do with COVID, and I'm still not saying it because I don't think I have the proof for it and may not be correct. But from anecdotal experience, what we felt was that even before the COVID vaccine came, people who took the influenza vaccine, when they got COVID, my diabetic patients, they did well. They didn't have any symptoms. It went off like a small flu. And they were convinced it's because they took the influenza vaccine. Of course, I didn't promise them, I didn't tell them anything, and I didn't tell them, yeah, I take the credit because I gave you influenza vaccine. But it's not surprising. It was a very similar one. And some kind of cross immunity must have developed. And that's the only thing we could do at that time. There's a very well-known, standardized, safe vaccination. So this is something which for diabetic patients we started doing. Now, when the COVID vaccination came, of course, we started giving the COVID vaccination as well. So pneumonia, coming back to question, I think pneumonia is something which we can very easily prevent with this pneumococcal vaccination. And remember, it's only once in a lifetime. And you generally don't need it unless you've taken it when you're very young, say 20, 30 years old. When you cross 60, they say take it once more. But you have crossed 50, 60 and you've taken it for your life, you're protected. It's a very simple injection, nothing in it, not very expensive, you can easily take it. So that is something which you can do and can prevent all these bacterial pneumonia and the deaths due to that. So any diabetic patient, even type 1 diabetic, juvenile diabetics, we don't give it that, say, to toddlers and to very young people, but anyone adolescent and above can take it, especially if they have diabetes. If they have diabetes, any age is not a bar. You can give it. For non-diabetic people, they say generally in adults it is sufficient. Above 30 years and all that sufficient. Above 60, the whole population should take it, whether you're diabetic or not diabetic. If anybody you know is above 60 years of age, ask them to take the pneumococcal vaccine. They don't even have to wait for diabetes.